Periodontal scaling and root planing. The objective of scaling and root planing is to remove etiologic agents which cause inflammation in the gingival, gum, tissue and surrounding bone. Common etiologic agents removed by this conventional periodontal therapy include dental plaque and tartar calculus. These non-surgical procedures, which completely cleanse the periodontium, work very effectively for individuals suffering from gingivitis, mild gum inflammation, and moderate-severe periodontal disease. Reasons for scaling and root planing. Scaling and root planing can be used both as a preventative measure and as a standalone treatment. Here are some reasons why these dental procedures may be necessary. Disease prevention. The oral bacteria which cause periodontal infections can travel via the bloodstream to other parts of the body. Research has shown that lung infections and heart disease have been linked to periodontal bacteria. Scaling and root planing removes bacteria and halts periodontal disease from progressing, thus preventing the bacteria from traveling to other parts of the body. Periodontal disease has also been linked to an increase in inflammatory markers found in the blood. These same markers have been found in people at risk of heart disease, strokes, Alzheimer's disease, rheumatoid arthritis, among other inflammatory conditions. Tooth protection. As pockets exceed 3 mm in depth, there is a greater risk of periodontal disease. As pockets deepen, they tend to house more colonies of dangerous bacteria. Eventually, a chronic inflammatory response by the body begins to destroy gingival and bone tissue, which may lead to tooth loss. Periodontal disease is the #1 cause of tooth loss in the developed world. Aesthetic effects. Scaling and root planing help remove tartar and plaque from the teeth and below the gum line. As an added bonus, if superficial stains are present on the teeth, they will be removed in the process of the scaling and root planing procedure. Better breath. One of the most common signs of periodontal disease is halitosis, bad breath. Food particles and bacteria can cause a persistent bad odor in the oral cavity, which is alleviated with cleaning procedures such as scaling and root planing. Depending on the current condition of the gums, the amount of calculus tartar present, the depth of the pockets and the progression of the periodontitis, local anesthetic may be required. Scaling. This procedure is usually performed with special dental instruments and may include an ultrasonic scaling tool. The scaling tool removes calculus and plaque from the surface of the crown and root surfaces. In many cases, the scaling tool includes an irrigation process that can also be used to deliver an antimicrobial agent below the gums that can help reduce oral bacteria. Root planing. This procedure is a specific treatment which serves to remove cementum and surface dentin that is embedded with unwanted microorganisms, toxins and tartar. The root of the tooth is literally smoothed in order to promote good healing. Having clean, smooth root surfaces helps bacteria from easily colonizing in future. Following these deep cleaning procedures, the gum pockets may be treated with antibiotics, such as Arestin. This will soothe irritation and help the gum tissues to heal quickly. During the next appointment, the dentist or hygienist will thoroughly examine the gums again to see how well the pockets have healed. If the gum pockets still measure more than 3 mm in depth, additional and more intensive treatments, such as a gingivectomy, may be recommended.